Hello, everyone. I'm Patricia Morency on behalf of Counseling and Psychological Services, CAPS. We're here today to talk to you about a subject that isn't talked nearly as enough, but is something that people are wanting answers to. What is that question, you ask? How to have sex during COVID-19. Let's face it, during this time of uncertainty about our health and wellness, people are still wanting to and are having sex. And so we wanted to dedicate some time to talking about some strategies to help you protect yourself and to engage in safer sex practices. Just want to be upfront and say that all the information that I'm going to be talking about is being pulled from the NYC Department of Health. They have a really good info sheet of tips and strategies, and so that is the information I'll be pulling from. This information will also be available online. So, are you ready to talk about it? Let's go. So, as I mentioned before, all this information from this presentation is being pulled from the New York City Department of Health. Sex and the Coronavirus Disease 2019, or COVID-19. So, first of all, everyone should try their best to stay home and minimize contact with others to reduce the spread of COVID-19. But the question that people are thinking, can you have sex? Yes, you can. But it's going to look a little different. So here are some tips for how to enjoy sex and to avoid spreading COVID-19. Number 1, know how COVID-19 spreads. You can get COVID-19 from a person who has it. The virus can spread to people who are within about 6 feet of a person with COVID-19 when that person coughs or sneezes. So that's why you've been hearing so many directives about staying at least 6 feet away to minimize contact. The virus can also spread through direct contact with a person's saliva or mucus. We still have a lot to learn about COVID-19 and sex. What we do know is that it has been found in feces of people who are infected with the virus. It has not yet been found in semen or vaginal fluid. We know that other coronaviruses in the past do not efficiently transmit through sex. So even though it has not been found in semen or vaginal fluid, and that other coronaviruses do not officially transmit through sex, you still want to continue to use the safer sex practices as if they were transmitted through these methods, because we don't know for sure. Something can come out in the future where there's a direct link between these two. And so you want to make sure that you're protecting yourself in the best way possible. Number 2, have sex with people close to you. And so who's the person that's technically the closest to you? Yourself. You are your safest sex partner. Masturbation will not spread COVID-19, especially if you wash your hands and any sex toys you may be using with soap and water for at least 20 seconds before and after sex. The next safest partner is someone you live with. Having close contact, including sex, with only a small circle of people helps prevent spreading COVID-19. Have sex only with consenting partners. You should avoid close contact, including sex, with anyone outside of your household. If you do end up having sex with someone outside your household, make sure to have as few partners as possible. If you usually meet your sex partners online or make a living by having sex, you want to consider taking a break from having in-person dates. So alternatives to in-person dates may include video dates, sexting, or chat rooms. Those might be alternative options for you. Number 3, take care during sex. Kissing can easily pass COVID-19, so you can avoid kissing anyone who is not part of your small circle of close contacts. Rimming or sexual contact by putting your mouth on someone's anus might spread COVID-19. So as we mentioned before, the virus has been detected in the feces of people that are infected by it. So just being aware that if you are engaging in rimming, that the virus in the feces may enter through your mouth. Condoms and dental dams can reduce contact with saliva or feces, especially during oral and anal sex. So you want to make sure to continue using these safer sex practices as you normally would. So continuing to use condoms and dental dams during oral and anal sex. Washing your hands is more important than ever. Washing before and after sex is more important. So when you're washing your hands, you're going to make sure you're washing them often and with soap and water for at least 20 seconds. You want to wash any sex toys you may be using with soap and water for at least 20 seconds. And you also want to be able to disinfect keyboards and touchscreens that you are sharing with other people for video chatting, for watching porn, and for anything else. Number 4, skip sex if you or your partner is not feeling well. If you or your partner may have COVID-19, you want to avoid sex and especially kissing. If you start to feel unwell, you may be about to develop symptoms of COVID-19, which include fever, cough, sore throat, or shortness of breath. If you or your partner has a medical condition that can lead to more severe COVID-19, you may also want to skip out on sex. These medical conditions can include lung disease, heart disease, diabetes, cancer, or a weakened immune system. For example, having an unsuppressed HIV and a low CD4 count. Number 5, prevent HIV, other sexually transmitted infections, STIs, and unplanned pregnancy. So, as I mentioned before, you want to continue using those safer sex practices as if you were before, preventing HIV, STIs, and unplanned pregnancy. So for HIV, that is using condoms, PrEP, and having an undetectable viral load. Those can all help prevent HIV. For other STIs, condoms can help prevent them. And for unplanned pregnancy, you want to make sure that you have an effective form of birth control over these next several weeks. So there are many different types of birth controls, including the diaphragm, the birth control pill, and others. Just know that condoms are the only method that are effective in preventing both unplanned pregnancy and STIs. So those are a good bet. So there you go in terms of tips to help you engage in safer sex practices. So before we head out, just want to give you a list of additional resources specific to U of A. If you're interested in just getting general COVID-19 updates in relation to the university, you want to head over to the health.uark.edu website. There's a link to specific coronavirus updates. In terms of the health center in particular, Pat Walker Health Center website is a great resource to use. You can also get linked up to the coronavirus updates, and you can also get any updates on how we are adjusting our health center hours for medical services and for counseling services. Speaking of counseling services, CAPS is offering telehealth services during this time. So we have a couple different options for people to use during this time. There's Let's Talk, there's virtual hours occurring, drop-in hours occurring. So if you're interested in kind of knowing what those options are, you can call us at 479-575-5276. Our front desk hours are open between the hours of 9 and 3. Just to let you know, that same number is also a 24/7 emergency crisis line. So if you are in a crisis, you really need someone to talk to in terms of coping with mental health, stress, etc., you can always call that number. And that number is in the back of your ID card in case you forget to jot this down. That is available for all students. So I hope that you found the information in this presentation to be helpful. And as always, continue to take care of yourselves and stay safe.